Yeah.
Okay, so
what are my count? My ANC count?
count has not improved, and it's not going to improve for a couple of days.
Okay.
Yeah, it's just gonna.
Because it's fine. I mean, was like what I find weird is. The many times I've been coming to the hospital between me and my daughter, I have never heard of a hospital releasing somebody when their count is low.
Oh, I see.
You see what I'm saying? They've always.
Yeah.
I've tried to leave in the past. Like, okay, you guys aren't doing anything for me here. Blah 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 blah. And they said, well, we can't release you with your count so low. We have to wait till it gets to above 500, and it has to be at that for at least 24 hours.
I see.
But now all of a sudden it's we're going to discharge you. So to me, it just seems like it's another reason. Like maybe because I was putting up a funk about not using the bathroom in public.
No. So I mean, I mentioned that as well. I mentioned that because your count is so low, is it okay for you to go home?
Yeah, because I'm just going to get sick and I'm going to be right back here.
And the oncologist doctor who you probably met earlier, so she's the attending doctor, and I'm a resident working under her. She said with your disease, it's a little different. That like for example, if I have blood count as like you, I have a very, very high risk of catching something. But for a patient with diagnosis of cyclic neutropenia, she's saying that it's a little different, that although numbers are low, that doesn't necessarily mean that you're as greater chance of getting infection as like if I were having that count.
Does that make sense to you?
I don't really know. No, it's not my expertise.
Who said this? Can I talk to them? Because unless I'm an alien or something, I come from another planet, my immune system is just totally different. That doesn't make a damn bit of sense to me.
Okay.
That if my immune system is low, I have a higher chance of catching an illness than you. With your system being normal. That doesn't make sense to me. She's basically saying, "Oh, I'm used to it."
I don't know.
Okay. Somebody's gonna have to explain that to me because her logic is different from common sense to me, or whoever said this is different from common sense to me and different from what every other doctor in hospital has ever told me. So that's why I'm saying, to me, it sounds like I'm just a problem. Or maybe they need to give the room to somebody else who they feel needs it more or something. Just tell me the truth. That's all I want to know.
No, there is no one like waiting, but obviously, like they said, if we're not doing anything to you, to recover you, we're just kind of sort of keeping you here, basically, right? Until you recover on its own. We, as a acute care setting, I think the team felt like it's not necessarily for you to stay here until your count recover, which is probably another 5 or 6, or whoever knows how long it'll take, right? I think that's the reason they said that, because we're not doing it. It'll be a different story if you're getting antibiotics, you're having a fever, requiring IV fluids, something actively going that we need to give you a medical treatment. I think they'll be like, oh yeah, definitely he's sick. He needs to be hospitalized.
Yeah, I mean, I hear what you're saying, but it's just I've made your argument before, and they wouldn't release my daughter, wouldn't release me. No, we can't do that. Liability issues, blah 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 blah. If you want to leave, you have to sign these papers saying that releasing
you're
us.
leaving against medical advice. Okay.
So, as a matter of fact, here was one of the places where I brought my daughter here, and you can look in the records. I think this was 2011. This exact hospital, I brought my daughter in here, and they didn't want to let her leave, and I wanted to sign her out, and they quote. So I'm being. You're telling me something exactly opposite of what I can go and get. I can go and get actual documentation for because they billed me, and it's in the records here. So something's not matching up.
Was your daughter hospitalized under hematology oncologist service, or just
it was hematology. It was hematology for her. It was for her blood disorder. Anastasia Hewlett, look it up. Her birthday's 5/13/05, and she was here in 2011 because it was I believe it was 2011. It wasn't too long ago. Okay,
I mean, I'm more than happy to grab someone else. And talk to you.
Yeah, I mean,
have questions.
I just want to know the truth. If I have to leave, I have to leave. But I don't like to be fed, nonsense. Because what you just told me, she said is nonsense.
Yeah, that's what I was told too. So
yeah.
Let me go get someone in the department who can maybe explain better for you. Okay.
Yeah. Okay.
All right. Otherwise, you're doing okay. Yeah. How's your throat doing?
It's a little better. I mean, as long as I keep drinking water, it's feeling itchy and dry right now, but I just have to get a sip of water. But
what about pain here?
Yeah, still there. Yeah.
Do you mind if I take a
walk?
walk?
Over here, right.
Look straight. Okay.
Yeah, right there.
Okay. Open your mouth. Say ah. Ah. Stick out your tongue. Say ah. Good.
And I still have it sore on the top.
Yeah. It's still sore on your face?
Yeah.
Okay. And the rashes are still there, I assume? Yeah. I mean, I'm sure it'll take a while. Okay, let me go grab someone, okay?
Okay.